Good evening to everyone and welcome Ashish ji. And we are a part of the stroke survivor group. Some of us are stroke survivors, some are caregivers. And we had some really interesting sessions. And I feel this music therapy will definitely help us connect to ourselves, the emotional being of all of us. Because life throws many challenges. That's what we were discussing, Sodiji and I. It throws many challenges and painful struggles also our ways, and we are all social beings. So health plays an important role, and even if we are healthy, I feel that that emotional being also needs to be healthy. And I think in this, from what I have seen in your profile, which Mr. Sodi had sent me, that you are a music therapist, corporate trainer, music composer, lyricist. So, and your areas of expertise is stress management, neurological rehabilitation, pain management, palliative care, developmental, psychological, and psychiatry disorders. And of course, the areas of interest listed here is music therapy, workshops, treatment, education, training. So, welcome, Ashish Kasbe ji, and please introduce yourself to all of us, and we can start the session.
Thank you so much, Anand. And first of all, I would like to thank Pradeep sir for introducing me on this platform, and he found me capable enough to share some details about music therapy for the organization. I'm happy to be a part of it today. Uh, so basically, as of now, I'm working as an assistant professor and a PhD scholar at Faculty of Liberal Arts at MIT World Peace University, which is in Pune. Before that, I was working as a clinical music therapist at Kokilavan Dhirubhai Ambani Hospital in Mumbai for 5 years. And after that, now I'm shifted here just for my PhD and education purpose at Faculty of Liberal Arts. I have created music therapy syllabus, and it is my you can say dream, or I think it's my responsibility. I'm trying to develop a curriculum so that it can be taught at a university level, because already some private organizations are into it, music therapy education, training, and practices. But I want this field to open to common students, and they should get certified from university itself. So that's I'm trying in Pune. So today we will be seeing, I'll introduce music therapy to all the participants. We will try to understand what is music therapy, how it works, and how it is beneficial basically for different types of populations and age groups basically. Let us go ahead. Let me share my presentation. We will, so the today's presentation I have made some slides. I'll be sharing with you some part I will be explaining. I have a couple of videos which I will be sharing with you for information like how actually these things work. So let me share the screen. So I hope you're able to see this. So let us go ahead and try to understand how music therapy can be used for stroke management. It's as today's topic, under Stroke Support India, Saturday's Open House Series. So as I shared that we will try to see what's music therapy in brain disorders. We'll see music stroke and music therapy for stroke patients, and we'll have a discussion about it. So basically, when we say music therapy, it is very, I can say upcoming or new field in India. in Western countries, it is very much popularized, and they do have a very standardized and structured voice is breaking up. Okay, am I audible enough, everyone?
Yes, you are to me, but yes, voice is a little bit breaking up. I don't know. It can be improved upon. You're audible.
Is there any background noise which is causing the voice?
No, not really, but I think perhaps some hissing when you speak. That's about all.
Okay. Is it about the voice intensity? Is it better now?
It is better now. I think it's slightly better.
Is it better? Okay,
Yeah.
I was being soft. Okay, no problem. I'll continue with this. We are getting some comment. I request someone to have track of it so that towards the end we can address it. Anandi ma'am, you will be saying this. Okay. So I was indicating about music therapy current status in India, basically. In foreign countries, they do have established boards for certification, for education and practice. In India, we are lacking behind, but we are trying our best to have a formal education and training, to have a standardization across. So to understand basically, what is music therapy? There are so many different definitions. I was irrigating to different associations globally because they do have developed their own definitions for it. I tried to study all the definitions, and I have got all the essence of it in this particular definition, which I would like to share with you. Is that it is a clinical and evidence-based use of music intervention. So basically, it is clinical and evidence-based. Why I say that? Because it can be replicated. A science which we call, जो हम repeat कर सकते हैं, which can be repeated. And it is a musical intervention. The way physiotherapists use physical movements, a physician or medical doctors, they use their treatment methods and the medicines to intervene. Same way as a music therapist, we use music as an intervention. किस चीज के लिए हम यूज करते हैं? We use this to accomplish individualized goals. सबके लिए we can't have a same treatment, right? So music therapy से हम individualized goal address करते हैं within the therapeutic relationship. उसका एक structure होता है, उसको follow करते हैं हम by a credentialed professional who is trained basically in music therapy. There are different settings in which this therapy is applied or used. It can be a medical setting, educational setting, everyday environments. And it can be used with individuals, groups, families, or communities for the purpose of to optimize their quality of life and to improve physical, social, emotional, intellectual, and spiritual health and well-being. So this is a complete definition or the meaning, you can say, about music therapy we can discuss. It is a 2021, but still there are different places where music therapy awareness is not reached, and some misconceptions are there even among people who are well educated, but they really don't know about it. So there are some misconceptions which I would like to address before going ahead. First of all, I'm not generalizing it, but it happens sometimes that if some patients, they have a particular issue this or complaints, there are some medicines which, if there is no allergy or if there is no other comorbid factor, then there are some certain set of medicines which are prescribed by doctor to patients. But in music therapy, it is not like that. It is very subjective, and a common piece of music cannot be prescribed generally to all the patients or all the people, because my choice of music is different. Your choice of music is different. So each person's choice, cultural background, their upbringing, their inclination towards music is different. Some people like melodies. like tune of the song. Some people are more into the lyrics of the song. They like meaning of the song. That's why they like the song. Some people like the musician or the artists who are there in the song. That might be a case. Sometimes there is some association with the song each person has. So there are different reasons. So that is why a common piece of music, or which I like, I cannot be describing, you should be listening to this as a music therapy. So common piece of music cannot be general prescription. Another thing I would like to address, even if I am a music therapist, even if I am practicing it, even if I want to promote or spread awareness about it, I emphasize on it that music therapy cannot cure any disease. Music therapy is not an alternative treatment. Music therapy basically is a supplementary treatment which goes along with the mainstream treatment and which supports the development and the improvement of patients when given adjunct to the mainstream treatment. So what music therapy can do basically is it can improve the dysfunction or disorder or status of patients, okay, instead of actually curing. Okay. The existing doctors are there, medicines are there, and we have a fantastic medical industry and new developments. Even the rehab in India nowadays is going very well. The third thing is, some people think that the patient or the person who is getting music therapy or wish to get music therapy should be musically trained. He or she should know how to sing or how to play instrument. That is another misconception which is not true. If a person knows music, a little better, so it will be helpful for a therapist to try a little complex or more different or difficult or interesting activities. But if a person is not trained in music, still music therapy can be applied. So there are a range of applications which I want to just brief you about. Music therapy can be applied for all the age groups, as you are saying. It can be used for women, as we know. Garbha Sanskar, in India, we pay more attention to. Then from newborn child to a senior citizen, geriatrics also. So in all age groups, we have music therapy applications. And in different settings, as I said, in education, or in hospital, clinical setting, corporates, or in any other different setting, family or social or society, anywhere we can do these applications. So which are the actual areas or segments in which actually music therapy can go ahead and work? So neurological disorders are there. Then there are developmental disorders. You have children with special needs, basically, autism, cerebral palsy, and Down syndrome. There are many other developmental disorders. Then there are some psychological disorders, psychiatric associated disorders. Palliative care is another domain where music therapy does a fantastic job, because another name of or another term for this is end of life care. In that, World Health Organization pays special attention to quality of life of a patient. And when quality of life comes in the picture, music therapy has a significant role in that particular region. Pain management is another area where music actually works fantastically, and it actually distracts our attention or our brain basically from the pain, and it engages person in music such a way that the pain perception, you all know that it is a theory. Pain itself has so many different theories. So sometimes it is actual physical or sometimes it is psychological. So music works well with this. And yes, as we all know, music is a fantastic element when it comes to stress management. So there are different areas where music actually can be. So basically now you will be thinking, what as a music therapist I actually do. So there are different settings as we discussed, clinical and other settings. So in each setting, role of music therapy changes depending on the requirement, basically. So in general, what a music therapist does is, first of all, assessment is very important in this, because unlike other medical professionals, we do not have any intervention. I mean, we don't have any X-ray or any reports which we ask. So for us to start any therapy or treatment with any patient, they fill all the medical records of patients, doctors, reports and all. And for us, we do music therapy assessment to understand the baseline from where we have to start the therapy. How is the patient? What are their likings? If patient is able to communicate, we talk with them. If patient is not able to talk with us, then we talk with their relatives who can help us with the information. Then we also have, after assessment, then we plan the treatment for patients. Then actual session goes on evaluation. So it is a process of medication. Then what a patient might be doing, you might think, what patients do in this therapy. So they improvise music, they play instrument with us. Sometimes they just listen to music. Sometimes the patient and therapist, they compose music. And experience sharing also is a part of it. So this is an amazing procedure and very structured procedure. That's why I called it very clinical based and evidence based and scientific, basically, because it is a structured procedure. So we get a referral, then we do assessment, formulating goals, plans, treatment, and then sessions, then actually different strategies, implementation, evaluation, and termination. How actually it works is a very big question. Okay, we understand music is there, you use music. How actually it works, basically. So there are different approaches or different areas how it actually works. So basically, first one comes as attention modulation. You all must have this experience. You had this experience. If we are, traveling, or if we are at some place, and if even at home, if we'll all of a sudden, if we listen to our favorite song or a song which we know, immediately we pay attention to that because it is so obvious for us. So first one is attention modulation. Then comes cognition modulation. Then our emotions, we are so much connected to music with different emotions. Then the behavior modulation and then communication modulation. So there are different ways actually music therapy works in actual sense. You will be asking then why music? Like why this therapy at all? So there are so many reasons due to which this therapy is effective and significant. First of all, music is a very much a medium for our expression. Immediately it garners our attention. It helps to change our mood. It taps into our emotions and memories. It gives us a social experience. It is non-invasive and safe. And music does have some therapeutic foundation. It helps us in physiological response and motor responses. And shared neural circuit is a very important part in this music therapy, basically. And not just us, but even the infants respond very well to music. And this, as you're seeing here, we as a human being, we do have this innate tendency or ability to create and appreciate music, which actually makes music very well tool to use as a therapy. Basically. Another part of it is the brain plays very important role, and as we are talking about stroke, there are so many elements of brain, its physiological structure or its functions comes in this. So brain likes patterns. It works on electrical impulses, so it likes patterns. Okay. And music, as you know, it is very much predictable. If one line is coming, you already know what is coming next. in your brain you already have the thing. So music is very much predictable. It is structured and organized, and our brain likes it. So all these factors, when they come together, it creates a fantastic platform for a therapist to use music for any patient. In this diagram also you are able to see how many different areas and how actually music is associated with different areas. So basically, if I tell you in simple words, music is processed in brain at different levels in different segments and different areas. So if you check any person's brain live when he or she is exposed to music or engaged in musical experiences, there are so many different parts of brain you will find stimulated at the same time. So that is why it gives a good hold to music therapists on different areas of brain at the same time. And music can be done very well with many patients. So there are different brain disorders. We will not be talking in detail about that. We will try to see how music can be used in the various disorders, different type of patients, focusing stroke. So as you all know about different types of stroke, you have ischemic and hemorrhagic. One happens due to the blood clot and the oxygen doesn't reach to brain, and at another place due to the bleed or rupture of the veins it happens, and with various treatments and diagnosis, different ways to diagnose are there, and comorbid factors play a very important role in this particular scenario, as I have observed and seen in different patients. So when we talk about some references like how actually music therapy have worked with different patients, so you are able to see different references I have shared for you. So first it says music is beneficial supporting neuroplasticity through engaging global system of temporal, frontal, parietal, cerebral, and limbic brain areas involved in auditory and language processing, emotions, attention, motor control, and memory. So it talks about, just say I was trying to, I just mentioned that there are different parts of brain which actually gets associated. Do we have the noise? Okay. Let me solve it. Okay. I hope now it will be better. So different parts of brain at a time, same time, it gets stimulated when it comes to music. Neuroplasticity of brain basically plays very important role in this. It can be a stroke patient or traumatic brain injury patient. When there is an injury to brain, brain has natural tendency to recover itself. And when one part of brain is affected and or not able to cope up with its functions, brain also has a fantastic ability that some other part of brain takes up that responsibility and tries to function to best of its capacity, basically. Another reference we have here is like use of live music actually enables the manipulation of specific parameters of auditory stimuli, which comes as volume, pitch, and timbre, which optimizes possibility of gaining more accurate picture of disorder of consciousness patients' auditory responsiveness. Okay. Then making a music is also a powerful way of engaging multisensory and motor network and inducing changes and linking brain regions within this network. So let us try. So first point we understood. Second, talking about the second one, basically music has different parameters. When we talk about it, has a lyrics, it has a melody. Apart from it, has different levels of volume, the pitches, low pitch, high pitch, and the timbre when different types of instruments or different types of voices comes in the picture. So different parts or elements of music has a significant relation or response or association with us, those factors, and the response, as it is mentioned, how patient responds to it. So basically, I have this experience. Like I used to also visit, ICU to see some stroke patients. That time, of course, some patients kind of having different levels of consciousness. Sometimes they're in coma, or sometimes in other state. So they don't talk, they don't respond immediately. So for what immediately thing, important thing I can see is their physical response or physiological response, which is very obvious when I used to sing their favorite song, or when I used to play their favorite song. So auditory response is very important. That is why music is very important, even if you are not total awake, little awake or unconscious. So still, music has a certain impact on us, basically. Then third point when we talk about, so that is what I know I was trying to explain before, that it's a multisensory experience, right? We see it, we feel it, there are emotion involved, there is memory involved. Every one of us has a certain kind of association with different types of songs, basically. Some song we have associated with some person, some songs we associate with some incident in our life, which is very natural and obvious, basically. And that is why it gives us a multisensory engagement, and internally actually many things are happening, the motor network, and there are different systems in our body which are connected to each other, basically. So once you stimulate one system positively, definitely the repercussions and the benefits to other system goes naturally through it. Also, if you see, music definitely has capable to elicit different range of responses, which indicatives of arousal and selective attention from different patients. So there are different number of articles and scientific studies done in this regard, which tells us that there is a implementation possible with music for the stroke patients. Okay, so as I was trying to indicate about use of music in different settings. So in clinical setting, music therapy works differently, where you have patient might be in ICU, patient might be in emergency room, or there is a step down ICU somewhere. We have after next to ICU, and before shifting to ward, there is a one area. Then after that, patient shifts to ward, and if condition improves, then they get discharged, and then they come on OPD basis in the outpatient. Sometimes it is a household setting, or sometimes community setting. In different settings, music therapy plays different role. So in general, which you will be asking, what benefits one would get through music therapy, basically. So first of all, physiological response is very important factor in this. Music therapy helps to alter your blood pressure and heart rate. It has a direct association with it. If you listen to fast rhythmic song or beat songs, your blood pressure, heart rate, it rises. If you listen to slow or relaxing songs, definitely it settles down very well. Then we have immunity, effect on immunity, basically. So different, positive, this neurotransmitter secretes, basically, when we are happy and engage in musical experiences, which is good thing, which helps us to improve our immunity also. Sometimes it also helps us to relax our different muscles and release tension. It helps to reduce pain. It helps us to improve our body movements and their coordination, because when we talk in terms of brain, some functions are associated with left brain and right brain. So when music comes into picture, the bilateral, the both sides of brain, they start interacting with each other very nicely, and that gives us very good output or effect. So the coordination also improves very well. So I always suggest the younger kids or the students to learn some kind of music so that they will the development will be very good. Apart from it is all the benefits which you are able to see, strengthening memory, improving their cognitive functions. Even these all benefits are associated with our stroke patient also when we use music therapy for these patients. Masks unpleasant sound and feeling. So basically, when patients are there, admitted in hospital, different machinery sounds are there, nurses are there, doctors are there, some equipments are there, that sound is there. And the feeling basically that I am not well, I am in a hospital, So music helps to mask that environment and gives a good feeling or a safe or a secure feeling to that patient basically, which helps and improves cooperation of patient towards the doctor or towards the treatment. If the patient is in not a good state, not in a good mood, he won't cooperate to that level. So it helps in that. Apart from which, is a very important question. Whenever I used to go to wards, to patient, I used to always ask the caretaker or the nurse in charge, like, how is the sleep of that patient? Because sleep is very important factor and plays significant role in that any person's daily routine or improvement basically. Also, it helps to improve another aspect into the relationship improvement, and also improves social skills and maintains positive stance. These are some tips or pointers I have published in one of the articles. So I share always wherever I go. Some pointers for everyone to follow. You can always take out some time to listen to music for yourself, and instead of analyzing, you can just enjoy whatever music genre you like. You can enjoy that. You can do your music routine things with music so that you won't feel it. If the boredom will not be there, monotonousness will not be there. And you can always try to sing or learn some musical instruments. You can prepare a list of songs for different occasions, different mood wise. You can prepare, and according to different timings of the day, you can listen to particular set of songs, and also try to listen some relaxation music towards night before you sleep, so that the quality of sleep improves and overall help. It helps you to improve that also. So before going to discussion, let me show you some videos, couple of videos which I have, so that then I will be done from my end basically. So let me see videos I want to show you. Okay. Just let me know if you're able to hear the sound also along with the video.
क्षमा कहे परवाने से परा चला जा, मेरी तरह जल जाएगा यहाँ नहीं आ.
Yes, so this is a stroke patient which is having a difficulty in speaking after the stroke. Aphasia we call it sometimes. So there are different types of aphasias. So this is one of the patients which I have. So this is before some initial stages of this therapy. If you able to hear my sound now, you at least able to recognize my song in the video, and the patient's sound. He's trying to. It is one of his favorite song, Kishore's song he used to like. So I tried playing as a karaoke, and lyrics and music was there on the system, and he tried to sing. So he's able to catch the melody if you're able to see. Okay, so he is able to catch the melody very well. He's trying his best to sing the words. And now I play second video. Just pay attention and then see how good he, after over a period of some sessions, he was really able to he tried his best to sing. And I'll just show that also. Okay, now I hope every time you have to select, okay, sound is there. Okay, so did you see towards in the initial line he was still trying his best, but a couple of words later he did it very well. And it is a good feeling when people respond to what you're trying to do, when they enjoy they're doing. So in this therapy now, it is a good thing which I like basically. So person or the patient, they don't feel like they are getting treated for anything. So they enjoy it. Is a musical experience for them, but for us, we know we are doing certain therapy. We are conducting some activities for some purpose, basically. So this is one. Let me try and see if I have one more. Okay. Okay, this is another video of one patient I have. So in stroke there are different things. So different parts of brain which are affected due to the stroke. The functions associated with that naturally shows some of the effect on that also, that functions. So sometimes speech gets affected, sometimes your coordination gets affected, sometimes motor response gets affected, the muscle gets affected. So this is another patient which I have initially. It was he was resistant. The muscles were so tight, the stiffness was there, and he was not able to. He used to understand, but difficult for him to do that. You can see his fingers are.
वाह, और ये हाथ से भी आएगा ना. आइए नीचे रखिए इसको. वेरी गुड. लाइए नीचे, लाइए धीरे धीरे. नीचे नीचे नीचे. बहादुर अंकल.
So you saw his fingers. He is not trying. He is not open. It is very stiff like this, and left hand at least he has little relaxed, but the right hand he kept very close to his body, basically very tight, because that stiffness is still there. In the second video, I'm trying to show how after over the period of time, how he started coping up and responding and cooperating, basically to the same therapy.
वाह. प्रेस मूव करो. मूव भी करना है ना साथ में, प्रेस करके मूव करना है ना उसको. हाँ, अरे वाह, करेक्ट करेक्ट.
So जैसे आपने देखा with right hand which he kept very strong, very tight to his body initially. That hand he kept relaxed, and even with finger he tried. Left hand fingers were still he didn't open it, but even with that limited capacity, he tried to press the keys even with his fist. So that was amazing experience by that patient and response. So there are many videos, many things to share, but considering the paucity of time, I'm stopping my presentation as of now. So if we have any question, if any comment, we can discuss on it. Let me know. So are we taking question and answer one by one? How we are going now?
Yes,
Could I address?
we can take that. We can open it to the forum. Anandiji is also there. And please unmute yourself or raise your hand, whichever way you prefer. And we will get to you by the by. And whatever your experiences, your queries, concerns, please feel free to share.
Okay, can I ask first?
Yes, please go.
You had shown us the videos which were very inspiring, like the progress which was there in a stroke patient. But it's really surprising to know that even the fingers opened because of. Is it because of music therapy also associated with physiotherapy?
Okay, so thank you for this question, ma'am. Actually, so basically there are different things which plays role in this. As I said, music therapy is not an alternative to any medical treatment, and I reiterate that, and I say that it is always a supplementary. So a major thing plays role in this is all the medical treatment, the medicines and the physiotherapy, especially in stroke patients when we talk about. Yes, Shruti, we will get back soon after this. So the rehabilitation itself plays very significant role in this. And as I was working in Cook Lab and as a part of rehabilitation team, so I have seen how significantly when all the multi-specialist team come together and work for them. So, ma'am, it is a output of efforts taken by everyone. The main, the neurologist or the if there is a physician, neurophysician involved, neurosurgeon involved, I mean, and the physiotherapist, occupational therapist in some places, speech therapist comes in, the medicines or the muscle relaxants, the Botox or any other which they use basically for patients. Sometimes patients' psychological condition improves. They are very resistant, hesitated in the beginning. They don't know you, why they will immediately listen to any therapist or any doctor. So that relationship, which if you remember I indicated in the beginning when I was trying to explain the music therapy definition, so in that therapeutic relationship, this music therapy works well when the therapeutic relationship is established with the patient and the therapist, and that it work wonders basically. So it is the output of everything. And so basically I want to with this answering this question, I want to tell that if you see in the videos which you saw, I'm basically not trying to teach music to any patient. It is not that music therapist or musician is coming and teaching singing or instrument playing. No, it is very much non-musical objectives we have with us. So in first case, if you saw his communication, we are trying to improve his speech, we are trying to improve. In other case, which you saw his motor responses, upper limb, basically is, we are trying to improve his response so that he will cooperate better in physiotherapy. Or if the person in the first case, he is trying to improve his speech with the song, he will respond better in speech therapy. Or his verbal or that, some communication will improve basically. So as a music therapist, my goal or, any music therapist's goal is to, there are different domains. We try to, help patient in different domains. That is answer to that basically.
As a clinical intervention, do you, like you were saying, I also heard about this, that sometimes, you are listening to music and you are engaged in some work and suddenly one particular song, makes you get into that rhythm. So maybe that raga is the rag on which that song is based. It could be even a film song, but even all film songs also are based on some ragas. So that raga is your, they say this color suits you, that this rag suits you. So do you, like you said, it was a clinical evidence-based intervention. So you prescribe the raga for each patient, or it's random?
Okay. So I think I just explained what types of activities I conduct with patient, basically. So one, as you saw in a photo, it can be listening, music reception, we call that. You either put a headphone with a controlled volume, and if making sure if any head injury is not there. And apart from it, you can put it on speaker with control volume again. So music reception is one activity, can be. Playing an instrument can be one activity. Sometimes I play instrument or sing for patient. Sometimes we both have some instruments together, music creation. Or sometimes with children we do that, or even with elders, their favorite song, we take that melody and we change the word. We put some instructions, or we put some information in it, basically, to indicate where they are, to indicate which day it is. We use their name to make them improve their awareness, self-awareness, and awareness about the surrounding. So there are different activities, and it is not always that only a raga or a song which is played works that way. To differentiate between use of music and a raga, so there is something called as time theory of raga. So if you study the Indian ragas, they are made and they have some time associated with them. If somebody wish to complicate it little more, then they can add Ayurvedic component in it. And there are three doshas of Ayurveda: Vata, Pitta, and Kapha. Each has a significant role in body, and they also gets altered during in association with time. So time is a common factor in Ayurveda and ragas. So body and body is affected by both ragas and Ayurvedic factors. So if some person is interested in that, he can combine both factors, and then little complex therapy can be used, but it cannot be used for all. Because not every person might like raga. Like the same way, some people say okay, or same way some people might not be interested to listen to Western music, or the new music. They like the 70s, 80s, or even older songs. So that is the case, So it is very subjective. That's what I indicated. Yes. So we have Shruti Gururaj wish to ask a question.
Hello, sir.
Yes, please.
This was a lot. Why music makes us so happy? It's because of the brain. I think it is only the music parts of the brain. I myself have a lot of connection to music because it has helped my husband recover in many ways. He had aphasia, he had speech problems. So his speech started improving the first day when he said a small shloka, when he sang a small shloka along with my father. The same day, the speech therapist started musical intonation therapy, where he converted very small sentence of just 3 words into music. So he sang everything, then converted into plain speech. This is one thing. Second thing is he used to play a particular music to get sleep. He asleep. And now whenever he does physiotherapy, he plays music, whichever he likes. And he's enjoying the music. And even if the exercises are difficult or the stretching causes pain, he is trying to overcome that with music. Apart from this, apart from sharing my experience, what I want to know from you is, in therapy, is there any particular frequency for particular problems that you use? I wanted to know about this.
Okay. So, okay. Yeah, thank you for sharing the experience, ma'am. And I'm happy to see music is helping your husband for in the therapy and otherwise in the routine also. So there is use of a particular frequency, but there are some in foreign countries, there are some specialists who use that frequency for a particular. Sometimes they actually use a tuning fork. They make person lie down and they use different frequency tuning fork and they play next to your ear. And sometimes there is another one which uses headphones. Basically they play, for example, a 200 hertz frequency in one ear, and in the second earphone, they put 210 hertz. So the 200 here and 210 here. So the resultant frequency is 10 hertz. So the brain starts, a response, or gets resonated with that 10 hertz frequency, and whichever frequency has they trying to actually implement, they try to play that frequencies in different headphones. If they want to achieve if want to stimulate person, then they will try to have a higher frequency, resultant frequency. Basically they want to relax or calm down the patient or person, then lesser frequency, the resultant frequency which they try. So it is little complex. I personally have not tried it on any patient, considering understanding the sensitivity of using that, and not affecting patient's current status. Sometimes you don't know how actually you will be affecting patient. So limiting music therapy to the musical aspect,
Thank you.
I feel is good. Yeah.
In the chat by Shatakshi
So one more question.
Deshpande. One second, Shruti. Yeah, continue. I'll say. I'll tell him later. Shruti, please continue.
Hello.
Okay, there was this question: can Hindustani classical music listening can help in stroke patients? This is what we were discussing about the ragas also, no?
Exactly. So, Ms. Shatakshi, basically, so I was trying to answer that in the previous question, basically. So again, it depends on the person. If that person likes classical music, then he can definitely use that. So when I do assessment of any patient, I try to understand their choice of music. Not necessarily I will refer my songs to them. No, it will not work basically. So whatever choice of music you have as a person, or that if we are talking about one particular person or a patient, their choice of music is what matters here. So directly we are not saying that any particular raga or any particular music will help a stroke patient. Basically we will try to let us try to use music for one particular reason, say non-musical goal. Basically if you're trying to improve stimulate them, trying to improve their alertness, you can use music for that. If you want to engage them in one particular activity, you can use music for that, to maintain their attention, to improve their attention, or their sitting tolerance, or their cooperation, or their mood, or their emotions, their motivation. Basically there are so many factors. It is not just physical. When you talk about patients, there are so many factors comes in the picture. So you can use music naturally. When you talk about raga, some raga have some natural effect. If you listen to them at particular time, you have certain effects on your body. So naturally you can listen to that ragas for general benefits. As I was trying to include Ayurvedic principles also, they also have this concept of 7 energy centers in your body. They call it as a chakras. So chakra activation is also another aspect in that. So some people believe in it, some people don't. So basically each chakra is associated with particular swara, sa re ga ma pa dha ni. So the 7 chakras and 7 swaras, the topmost is Sahasrara chakra, which is brain, associated with knee. And so there are different ways to activate and improve that. So there are different ways. It is just about the person who is doing the therapy, or the patient who is receiving the therapy, their choice and their capabilities. That's what it matters.
Hello.
So as a music therapist, you need to have complete knowledge about classical
Exactly,
music, whether
exactly.
it is Indian or
even if you are not a master of it, having a knowledge how things are, how things goes, what is important, and how significant it is, what is your limitation, till what limit you should be using music. There are certain cases where we have tried not to use music. Sometimes patient is hyperactive, or if you think that music is overstimulating that person. It happens mostly in sometimes traumatic brain injury cases I have seen when patient is getting recovered, slowly they start gaining the awareness, alertness, and mood changes, and their behavior is strongly affected because different parts of brain are affected in brain accident or other the traumatic brain injury cases. And I use music. So in that case, I use music for the relaxation. So at different with different patients and different stages of their improvement, or of that patient, music intervention of music or role of music therapist completely changes. I have patients with the same patient in ICU. I have worked to stimulate them a bit. When they come to ward, I use music to relax them because they were getting hyperactive. When they got discharged and they came on OPD basis, I use music for interaction. So different ways to interact with them. So that is how it is.
Hello. Hello.
I think Roshan Lal ji and Sodi ji also have these things.
Yes. Hello. Hello, sir.
Yes.
Yeah.
Yes.
Sir, actually, sir, my dad, he is a stroke patient, and it has been 5-6 months, and we are continuously going for physiotherapy and medications. But sir, his left side, left leg, left arm, it's very, very heavy, and because of that he cannot move properly, he cannot do his daily things, so he's very depressed, sir. How can we help him?
I think you should be getting advice from his doctors, a neurologist who you are going to, or the physiotherapist you are referring to, because is there any association of like which part of brain, if the motor response is affected, we need to check that basically.
Sir, it was actually ischemic stroke. इस्केमिक स्ट्रोक, एंड वो कहते हैं कि नर्व्स जो है वो दब गई हैं, एंड क्योंकि नर्व्स दब गई हैं इसलिए हैवीनेस है. तो सर अब वो इतना फिजियोथेरेपी करवा रहे हैं, मेडिकेशन खा रहे हैं, तो क्या वो नर्व्स वापस नहीं आएंगी, उनका मतलब बारीपन जाएगा नहीं?
So basically कैसे होता है, in stroke there is no time limit basically. Sometimes patient shows good responses within a month or sometime over the period of time. So the chances we can keep trying as in rehab. If you see ऐसे नहीं है कि you have to try in the first month itself. Definitely the chances are better when you start early intervention rehabilitation. But continuation and practice or regular, when we keep one thing, definitely it can produce some good results basically. So if you want to try using music, you can use music for his motivation basically to yes, you can definitely make use of it to improve his motivation and his mood and his cooperation basically. Because from your question, having a physical deficit like or difficulty to move the leg, it seems that कि उनको मानसिक तौर पे on that level also he needs some support. Yes, so you can use music for that particular this thing, and with your medical professionals you can try to see what is the prognosis कि कैसे वो improve हो सकता है, what are the chances and how actually they can do it. You can
तो सर हम
try
वो
to
म्यूजिक,
understand.
जी सर म्यूजिक थेरेपी के लिए कैसे कंसल्ट करना है, कहाँ करना है, वो हमें कहाँ से पता लगेगा?
आप कहाँ से है basically?
मैं जम्मू से सर, हम जम्मू से हैं.
Okay, let me see. If you, I will be sharing my contact detail. You can have my contact detail. I'll try to find if I have any reference from that region. I will share that with you, and you can take their help then.
Yes, sir. Thank you so much, sir. Thank you.
Thank you. Sir, Hadip, sir, you have. Sir.
Yeah, if I may ask, there were 2-3 questions that were coming into my mind as we were proceeding. Very early on, you said something that the therapist needs to be credentialed. So, who gives those credentials, and what is the the process? Can, for example, I as a layman, if I want to know whether a particular therapist is properly credentialed or not, is there a means how to do that?
Check that.
How to do that?
Validation, basically.
That was one. And second was other question that I had, which is in fact raised by one of our members. He's not here presently, but it is the other, let's say, direction, in the sense that he was a very good singer, deep interest in music, suffered a stroke. Now his sense of rhythm is missing. He cannot sing. His sense of rhythm is missing. And that is leading to a lot of frustration. He's very successful actually in his recovery, basic recovery, I must say that. But his frustration is coming from that, and he has kind of made a baseline कि जिस दिन मेरा गाना ठीक हो जाएगा, उस दिन मैं पूरा ठीक हो गया. That's where he is coming from. So in your experience, have you had that experience also, that people have lost their sense of rhythm, and then how do they get it back? What is the process? That's the timeline. If you can hear a bit about that. Thank you.
Yes, sir. Thank you so much for both the questions. Let me answer for the first one. Just I was trying to explain in the beginning about current status of music therapy in India. So basically, in India, we do not have any, unfortunately, any body which will certify music therapists at state or national level. We are working towards it. So by the time, how one can ensure, that the person who is doing therapy basically is well trained and well versed with the different methodologies in music therapy. Only thing which you can do is checking their training, how the training is given. If it is just an online course or just a theory course is done in music, or actually if actual clinical internship, if the person is trained in internship with different types of patients. So if you ask me, basically, there is a Chennai School of Music Therapy in Chennai, which is run by Dr. Sumati Sundar. She has done her PhD in this. So there I studied music therapy as a part of a theory also as a half course. And the second half of the course was actual clinical internship. I work with patients in hospital. So that's how I came to know about different protocols and ethics of working with patients, which is very important, because when you come in contact with patient, you're dealing with one human being, and it is a very important and a big responsibility. And we cannot play, when you are at a place, you cannot be that innocent, and you have to be genuine. You have to try your best to improve their status. So you can make sure if he is well trained and he has got the training to work with different types of patients, and having knowledge of the different areas which we are talking today, not just anatomy, not just physiological aspect, the different the knowledge of music itself is very important. The different associated areas or the domains, knowledge in that also is very important. So that is the only way as of now. In future, I hope we will have a board which we are trying to have a standardized education, training, and therapy structure. And soon they will try to certify, the way we have physiotherapists which have a license number, or any other medical professional. They do have license for practice. We will try to have that soon in India. About the second question, which you ask about that particular, one patient or person, basically, sense of rhythm, which you mentioned. I immediately remembered one of my patient. I forgot her name, and she was a fantastic singer. She had a stroke. She is in her early 40s and very young, and she lost her sense of a pitch, the pitch perception, which we call it. She was a fantastic singer, but she just couldn't match her pitch to any of the song which I tried. And even that, in that case, she was getting that frustration and that feeling. I could see that she's trying hard to hit that pitch or that note, but she's not able to. Unfortunately, you can teach song to one person, but in your case, which you when you told about a rhythm, which is very unique feature, not everyone can be trained in rhythm. They say in music fraternity, they say that it is inbuilt. You born with that sense of rhythm. Particularly if you think about the people who play the air-based instrument like flute, or associated with that, or a string instrument, the satar, or very classical instrument, veena, or that. You need to have that thing in within you, that association and the pitch and the talent, then you can improve that talent basically. So teaching rhythm to one is very difficult, and in this such cases where a person lost a sense of rhythm, or what you say, speech perceptions, it is very difficult. Sometimes they, it is difficult to get it immediately, back. Sometimes it takes time. Sometimes it can return, but I have not seen in that both the cases. I have not seen in my patients in 5 years where I worked with them. So what we can try, we can train them using metronome. If you want to be particular in that case, you can give them external support of a beat, and you can make them follow that beat. That the person can do, matching a rhythm. Even we use that for patient who has a gait disorder. We use rhythmic stimulus, rhythmic auditory stimulation, we call that. We use that for improving their gait patterns or their way to walk basically. So I hope, Hardeep sir, I was able to answer your questions.
Yes, thank you very much. I think that will be a help going forward. Also, other question that came to my mind, particularly, given present times, what we have seen, during COVID times, tele-rehab coming to almost center stage for some time. So are you also seeing some possibilities, some happening there in case of music therapy? Do you see it happening, or do you see it going forward?
So I understand the importance of, taking therapy to a new level, basically in this pandemic. Partha sir is there, and we both have attended very much. Yes, sir. Namaste, sir. So, with Dr. Nirman Surya, which Hardeep sir, I mentioned with you earlier, in IFNR, they are doing fantastic job together, and they are doing this tele-rehab, things. But if you ask me personally, some of my colleagues are using this. But for me, music is very personal experience and very subjective experience. Unless and until you are connected with that person which you are talking to musically on that emotional level, before doing therapy, I don't think the therapy will take place. And I'm not sure. I have not tried. I need to try that first to see the effect. How actually, it can be done. It can be done, definitely. I'm not denying the possibility. But then in that case, very many factors we need to consider. If the person is really paying attention to what we are saying, there is many technology issues, network and other clarity and that. So if there is one person with that patient or that person, to assist or guide or help them with the activities, then I can see there is a possibility to take music therapy through online modalities. Yeah.
Fine. Thank you, sir. That is to some extent, yes. Let's hope that it grows. And of course, music is an intensely personal experience. No denying that. What is music to me is noise to you.
Exactly. It is very well said. Yes.
That is how it is. Anandiji, over to you. Yeah.
If there are no more. I had one question for you. In the presentation, you had written about assessment. So, how do you assess for music therapy?
In India, we still do not have a standardized assessment for music therapy. But when I joined hospital, I decided to have my own assessment pattern. So I studied on different assessment patterns, which in foreign countries they use, especially in music therapy. So even those are for different types of patients. So I tried to include all the things in my assessment. So I used to basically information, and then that their physiological parameters, how if the person is having high blood pressure or any issues related to heart, and then what is the diagnosis, if they had any treatment, what are the treatments going, what medicines are prescribed, because sometimes some medicines also have some effects, like good in like positive also nowadays good medicines are there. So this type of things I try to understand. And apart from medical information, then my music therapy assessment comes in that part, like what type of music one person like in general, if they have any particular favorite artist or musician, or a particular track is favorite sometimes. So this type of, or if they are trained in music, or if they wish to learn something, sort of that information I try to understand through the assessment, and then I start my therapy.
While I just had another query, you mentioned about that you were having people composing music also. So
Yes.
In your rehab experience, have you had that experience that people stroke affected or other people, they are motivated enough to compose music?
Yes, so basically, we cannot, compare that with the actual musical compositions which we listen to. But in that their own capacity, writing some lyrics, expressing their emotion through some lyrics, and then using those lyrics to in their favorite tune of song. So one of their favorite song we can take, and in that we can use their own lyrics, and then we can sing. So that kind of experience, is possible, and we do that with patients. So which is very personal and subjective to that patient. So it means a lot to them, basically.
Absolutely. Every, even the slightest improvement counts. And there is a very strong motivation. I have a video somewhere of a stroke affected. He was a trumpet player, before stroke happened. And, that requires very fine movement of the hand. It has taken him about 6 years, but yes, he recently, sent a video where he's playing the trumpet again. So to that extent, it certainly serves as a very strong motivation.
If you, there is one video, I don't have the URL immediately with me, but one ballet dancer was there, and that video was, viral in that particular fraternity. That in her young age, she used to dance on her favorite music track, and I think she had a stroke or lost. She was diagnosed with either Alzheimer or some Parkinson's, something, I'm not sure. But she was sitting on a chair, very old, above 80, I think, and somebody played that music next to her, and she was so happy. She started smiling and started moving her hands to, the same way she used to dance.
Yes, so, right. I remember. I've seen that video also.
Yes.
Evoked those memories again in her,
yes.
And I've seen wonderful.
Yes.
Experience there.
Yes, sir. Please.
Parthaji wants to say something.
No, I first of all like to congratulate Professor Kasbe for a wonderful 1 hour I spent just listening to the great field that lies ahead all of us. Now, like exercise, which is free, music is also free to all of us, but nobody speaks about it, nobody prescribes it, and nobody has been thinking about it before. And Professor Kasbe has just given us this 1 hour of extremely valuable information. I was privileged to be part of one of his talks as part of the IFNR series of lectures during onset of COVID last year. So I'll tell you, actually, I was sent an invitation by Sonal Chitnis is actually in your city, and she sent me the thing because Sonal is using musical beat structures for treatment of aphasia.
Yes.
So, yes, I know. I'm also in this circuit, but I like to listen, I have to say. I also asked Shantala to come today. Shantala Hegde is I think she will be the leader in musicology and the brain.
Yes.
She's in Nimhans, and she's doing lots of research on this. And I was actually chairing 4 days of ESCOM, European Society of Cognition and Musicology, which finished last Sunday. Actually, because there's our convener today, moderator, Mrs. Giridhar, is it? She was asking a few questions. I didn't want to steal Professor Kasbe's show, but with Professor Kasbe's permission, can I answer a few questions and you can correct me?
Yes, sir. Please. It will be, yeah. Yes,
and
please.
Just prove you my credentiality. My violin bow and my violin is less than an arm's length from my computer desk. So, and I am actually also a musicologist, because if I turn to one side, you can possibly see my score here, my violin score. So they're all within, arm's reach. I'm actually a medical doctor, a professor of neurology for India. And the point is, there are some things which are free in the world, but because there is no businessman or middleman in the middle, that never goes out. Although it's part of social custom, have through centuries been practicing it. Madam, you started off by asking about health. And just not, we are having a meeting now of the Asia Oceania Rehabilitation Conference for 4 days, and we were discussing holistic medicine. The Ayush program that Modi ji has tried to put forward has created controversy, because there are stakeholders like me who will like those people to come into the network. And for neurological conditions, there are about 3,000 neurologists in the whole country, or 1.37 billion. There are 900 physiatrists, which is doctors who will look after stroke rehabilitation. There are about 45,000 physiotherapists for all of India. That's it. Speech therapists, 23,000. Occupational therapists, about 20,000. And possibly music therapists, like Professor Kasbe. You can turn the video on if you want to. I'd like to see your expression. I'm not going to be saying.
Yes, sir. I'm on it. Actually, the bandwidth is fluctuating here. So
right.
To maintain your audio, I want to listen to you. Yeah.
Okay. I'm just pulling your leg. I'm just being, just being a friend.
No problem. Yeah.
Doctors have a problem about, protecting their own territory. But this is a patient's network, and the only person I answer to is the patient, because that's why I have entered this profession. I'm 33 years into it. Hopefully God gives me the good health to serve people for another 30 years. And then I want to, finish and go somewhere. So the point is, we must direct all our energy for patient well-being. It doesn't matter whether I am making you well, or Professor Kasbe is making you well, or the Ayush practitioners are making you well, or anybody. Because being a patient or a patient's carer, and only yesterday I was attending the Carer Summit from Bangalore, organized by the Andhra State Council. And there's Dr. Patil, who is actually doing good work to build up the carers, because I just heard that Roshan Lalji's daughter, I think, wasn't it, madam? You are asking about your father's health. So there are things in place, laws in place coming into force, whereby there will be a carer's allowance, carers getting time off from caring, because carers also have burnout. And carers' health and mental health is not being recognized. Again, psychiatrists in all of India is just few and far between, drop in the ocean. So mental health is a big problem. I think our convener asked, I've forgotten your name, sir. Sorry, you have not written your name. You write Stroke Support India, but you must give me your name, sir.
Hardeep Sodhi, sir. Hardeep.
Mr. Sodhi. Yeah. Mr. Sodhi said about, the corona, but what a big impact mental health has taken a hammering across the board, everybody. Common man to the Prime Minister. Prime Minister is having to worry about finger 4 in China, about the corona, and about the party politics. And the last man standing is worried about where his daily bread is going to come from. And there is a whole of us in between, you see. So it has affected everybody. So answering, I'll be short now. So regards health, you mentioned, madam, there is a physical health, which we can define. The mental health also has got, metrics, rulers. There are scales like blood pressure, but we're not used commonly. There's a stigma element. But for mental health, doing good exercise is helpful. Playing music, whatever your cultural part is. I'm a Bengali, so we have our own Bengali music. But there's Punjabi music, there's Marathi music, there's Telugu music. Whatever is culturally appropriate for you, if you do it as part of the normal daily, like the bhajans and kirtans we have, is nothing but group therapy, encouraging social bonding, psychotherapy, antidepressant effect, because all this circadian rhythm, daytime raga. My wife's actually a musical expert, and I also do musicology. In Western music, it's slightly different, but there's a major scale and minor scale. And because I'm actually taking 1 hour lessons on Zoom. On Zoom, everything can be done, sir. I am taking violin lessons. I'm taking vocal lessons on Zoom, and my all children are taking saxophone, flute, piano, singing lessons, all on Zoom. So if we can learn by Zoom, if I'm talking to you on Zoom, then the patient can, yes, you might need to see them once. Then you establish the personal relationship. And after that, you can be remote. Like in Jammu, well, I'm in Liverpool and you are in different parts of India. Doesn't make a difference, So it's the voice tonality. We communicate 60% by the tone of our voice, 40% by what we say. I think, and about 5-10% by the gestures we make. That's how human beings communicate. And even before we started talking, speech, language, 7 to 10,000 years ago, first language development, either in Anatolia area in Turkey, or there's another view coming up, it may have developed in Africa. But sounds developed 40,000 years ago. We imitated sounds of birds and, animal sounds. And that's how the first human beings communicated. There was no formal language then. So music is just, our om that we say, and the entire scale that you said, and you talked about the Ayurvedic chakras and all the rest of it. I mean, and the madam mentioned about the spectral analysis, color and sound relationship. There's only 7 colors, there's 7 sounds. You see, it's all physics and mathematics at the end of the day. If you boil it down, eventually the Big Bang theory, you can bring it down to numbers and maths. It's entirely Pythagorean, but we say Pythagoras, but we don't talk about our Indian mathematicians, Aryabhatta. They did all the work before you. See, just 5,000 years old, we are, what can we say? I'm not going to say anything more. You understand?
Pythagoras himself has talked a lot about music therapy, along with some great philosophical, view. Amazing. Like they have theories, maybe Pythagoras apart from maths.
I have we say neurogenetics, and I have the laws of Manu here, and they're all neurogenetics. I've got the book on mathematics and Pythagoras. All I'm saying is that we Indians, and possibly the Chinese as well, have done all this research 5,000 years ago. Our fault, we did not write it down, and through generations by oral route. By listening and passing it on from father to son, we have lost all of it. And then there will be other cultures coming in, Muhammad of Ghori, Muhammad of Ghazni. And then first of all, you are going down on the remembering, because nothing is written down. So there'll be some distortion with time. And then there'll be other challenges coming from outside. Which will destroy the original Indian. I'm not sure what religion they had, but they were just Bharat. So whatever religion was there in Shushrut's time, Charak's time, Manu's time. So, that's the heritage of India. So we all have it in us. So we don't need to get anything from outside, because all here, it's lost for some time, but we're going to get it back. Like, we got the first gold medal today, after 142 years in athletics. That's the best thing that could have happened. not in my lifetime has India won a gold medal in athletics. One individual, one medal. So, and totally outsider. We didn't expect him. Nobody knew him. So, things are going to happen. So, yeah, all I'm trying to say is that I'm actually also a musician, and I'm training from when I turned 50 to develop the secrets of the brain through music, because we, as Professor Kasbe knows, in stroke, lots of things, when you want to drive a car on a road, the road is broken. So you send the military and they will develop a pontoon bridge. And after you drive your tanks over it, the heavy tracks and all the rest of it, Shaktiman and everything. And then you build up the concrete and then you build up the road. So basically music will help to set up those fiber tracks which have been damaged in the stroke. So I'm just coming to stroke now, because stroke, let's not talk about Parkinson's or anxiety or depression. That's different. Because I was making notes as you were talking. That's my bad habit, you see. So first of all, the motivation, the mood, and the anxiety phenomena. You said what makes a stroke patient suddenly start to talk. Because first of all, the talking basically is a metronomic thing. It's a rhythm, beat, prosody, articulation, and word selection. And all of this is there laid out in the brain. Somehow there's been a shock to the brain by the stroke. Then all the rearrangement will take place. Like when your computer crashes, you often have to reboot it by hard set. You press the button. And then you can see Windows doing lots of things, 0%, 37%, 20%. It's actually resetting the whole platform. So the brain, and the sooner you start to reset the whole thing, the better is the outcome. So like your computer crashes, nothing is, you straight Alt, Control, Delete, nothing happens. Press the hard press button, it automatically reboots. And when it's rebooting, it doesn't come up with, it goes into safe mode at times. We've seen that. And in safe mode, you have to press the button to restart in safe mode. And then you can do, I'm just using a common problem that everybody faces, so it's, how the brain works. It's just like that, no rocket science. Let us, doctors who, have been trained in Western medicine, not make the brain any complicated, because as a patient, as an end user, you need to understand the whole thing that's going on in a language that is familiar to you. इसलिए मैं सोच रहा था कि मैं हिंदी में बात करूं कि नहीं, लेकिन मैं बाद में सोचे कि यदि यहाँ पे कोई साउथर्न इंडिया से कोई हो तो वो मान जाएंगे कि हम नहीं समझ पा रहे हैं. इसलिए I'm speaking to English, but if somebody does not understand English, I can translate the whole thing in Hindi. I don't know any Southern Indian language, by the way. So, from a stroke point of view, there is definitely the speech can be improved with music and the metronome, which I have. It's only a small instrument, you see. Even during walking, you can set it up. I mean, you can walking, when people who have difficulty in stroke and walking or talking as well, you can just set it up. It's just a, 100 rupee thing. We all have it. Whoever plays music to develop. And I think I don't have any good rhythm sense, but these can be developed, because you see, it's to do with some tract in my brain which doesn't understand rhythm well. So all I do is basically practice in, polishing something. Like when a child learns to walk, he doesn't know how to walk. He falls a few times, he gets up, he holds something, and then he cruises, and then he gradually learns to walk. So, and again, the human tone, everybody has music within them. So even if, you're a patient, that storage of music inside, because everybody's listening to the grandmother or the mother singing them lullaby. So that's the sort of music we are all, then all we start listening to the local language music, be it Punjabi music, be it Bengali, be it Tamil music. That's what we are born with. And then as we gradually move around in the whole world, we pick up other, there's music all around us, you see, sound structure. And then there is the music I don't understand is the electroacoustic music. But young people all understand it. Maybe there is something out there in the electronic variant which I cannot link up with. So like, if you give me a Chinese book, I won't understand it because I don't know the language. But if you give me a Bengali book or English book, I can understand it, and it's a good thing. So from a stroke, there is a huge potential for musical intervention. And going to these conferences, I found it for the first time, there's a lot of research taking place in the musical world. There are PhD students entirely dedicating their care in music. They're doing fMRI, tractography. These are specialized MRI softwares. Same thing, the head goes inside the machine. The softwares do everything. So there's nothing special about all of them, because our problem is we try to make medicine so complicated that eventually we even lose, in whatever respect we have left. We've got a lot of respect in the Corona era by being COVID warriors. We must keep it up, the public have suddenly regained the faith in the doctors. And it's our duty to make sure we don't let it go, because, when you get somebody's trust, you must hang on to it. So the best thing is communication we're talking about, because I was also in an Indian Medical Association meeting, IMA headquarters, where Dr. Narottam Puri, our cricket commentator, he came, and the main thing he was emphasizing was the communication between the end user, the client, the patient, and doctors. And doesn't mean doctors, will be nurses, physiotherapy, occupational therapy, speech and language therapy, psychologists, Ayush practitioners, musicologists, whoever is interested in getting somebody better. I can make some diagnosis, do some tests, give a medicine, but I need the whole other 7, 8, 9 people, colleagues, not people, colleagues, equally efficient. Some of them are more directed towards that particular patient at that point of time. Because when you have a stroke, you need thrombolysis. You need a nurse to put a vein, X-ray doctor to see the scan, me to make the decision, yes, break up the clot. After that, pretty much I have got no more role in the whole thing. It's up to physiotherapy, speech therapy, occupational therapy, music therapy, cognitive therapy, psychologist coming in, and then social worker, and then carer. That's the path that every stroke patient should be following, because we were having all nations were presenting their health systems today. Taiwan, Japan, Laos, Vietnam, Singapore, Malaysia. I was there the whole day because we were having the AOC and I was listening to everybody. I was listening to whatever everybody else is doing. And by the way, Kasbe Sahib, in England, nothing of that happens. I've been here 27 years. I've not seen anybody listening to music as part of therapy. So you are doing more than what England is doing. Honestly, I'm telling you, I'm nothing against England. I've been here for 27 years. I've earned my bread and butter from here. Music therapy is not part of National Health Service practice. It is not. In fact, the only place it has got a role is in the persistent vegetative state, where you are applying headphones and waking people up who are in deep coma for a long time. And again, that works. But nobody actually has done any, has pushed that research forward. So anyway, I think I've done half a lecture for Professor Kasbe. Sorry, I stole your thunder, but I was feeling like, thanking you for bringing this very important therapy area. How does it work? Well, at the moment, like all research, it's observational science. How much is the benefit? 70%. Again, Professor Kameshwar Prasad from Ranchi who was the AIMS director of Delhi. He was saying that if you do nothing of rehabilitation, 70% of the lost tissue will recover on its own. It's that last 30% of what is to be regained where we are trying to push the boundary. And the sooner the better, because you want to be back to 95% if you can. So for that, all this additional thing, because the brain has got normal power of regeneration, plasticity, as you were saying. So brain will automatically do a lot of good to itself. We doctors at times do things that might push the brain back in stroke. So in stroke at times in England, when we didn't know anything, I'm doing neurology here from 94 here. So do no harm, very important. If you can't do good to the patient, don't do any harm. So let nature rule. if you feel any treatment is not of evidence, don't treat. Leave it. Leave the patient support. Feed like a plant. You feed the water, sunlight, plant will grow. If you want to add fertilizer, make sure you're giving the right one. If you give too much of acidic fertilizer, you will burn the root and the plant will die. So don't do that. The plant will get its own fertilizer from the soil, from the natural bioflora. So, likewise, now we know a lot more than we did in stroke rehabilitation. And now we have got, people will ask for evidence. So we have got the MRI data to show that playing music lights up different parts of the brain, as you were saying, left brain, right brain, you were saying at the beginning. Yes, perfectly. I mean, these are all evidence-based talks that you gave. Anyway, I will keep quiet now. I've spoken for more than I was supposed to, but it made me feel very good that we're discussing all this on a patient forum, which is very important, because at the end of the day, all my knowledge is wasted if at the end of the day, I cannot convey it to my patient, wherever they might be. If I can't make a class 5 student understand what I'm saying, there is no point in my knowledge. A class 5.
Right, so even same way, I think even the patients I work with, when they put smile on their face or when they show some improvement, we as working professionals feel amazing. And same thing,
you feel empowered that you have made, because you will not be able to get them back to normal. So managing expectation is very important, because like Roshan Lalji's daughter was saying, will my dad get completely back to normal? Possibly not. But we were trying to get him up to 95%, and even delayed neuronal recovery can continue for years and years. That's because the brain is itself doing its own work inside. All you're doing is basically supporting it like a child, you're putting him to class 1, 2, 12, and then maybe he'll win the Olympic gold, because today is Olympic gold day, you see. So you do not know. And he was apparently quite a fat kid. I think somebody's saying he was overweight when he was young, and now see how he's got through the javelin so far that it beat everything. And, PV Sindhuji also nearly got our gold. Our, Mary Kom nearly got all our, so basically, we need to excel. Now that the country is flourishing, gone are the days when you had to be a doctor, an engineer, or, a set jobs. Now any job is possible, including being a top-class Olympic athlete. Yeah.
Indeed.
So
thank you.
Or a good musician. Or a good musician. We haven't had very good, we have had Bollywood music. So music, we must develop the next generation of good musicians for the country who can represent India on the world stage. We have had good film music, but we haven't had any. We have had, I won't mention any one name. I know Ravi Shankar because he's Bengali and all the rest of it. But, we haven't had really a classical Hindustani or Carnatic musician who has taken on the world stage. We want somebody along those lines. Composition is difficult of music. You were mentioning that because as part of my exam in music, I have to compose music. There are rules of composition. Do you know that? Composition is not random, because you see, I had to study Bach and Beethoven and the classical things. They were extremely good mathematicians, and they knew the numbers between the notes. There are certain intervals they had to write out to you see. So it's very much of a mathematical structured process. They've done it so many times that it becomes automatic and reflects to them. So even composing music is very much like, writing a good poem that makes sense, conveys an idea. It's just not stringing a few notes on, electronic, we have got lots of space to compose music. And we're not stealing music from anybody, we must compose our own music. Lots of people have stolen lots of the Hindi notes. I have complete, English correlates from 20 years ago. But that's not right. We are rich enough to, produce our own songs, our own talent, because that's what our people will like. Because I'm still on the music and stroke theme. I'm just coming to it from a different point, you see, because you said what music should be here. Like the daily biological rhythm that you were talking about, madam. The rags, the morning rag is different to the evening rag. If you play the morning rag in the evening, There'll be a mismatch because your body's hormones and enzymes and the entire endocrine system is going through a clock all the time. And this music actually goes inside your brain and sets up an endocrine circuit. If there is a mismatch, if you are basically, working if you like get up at 2 o'clock in the morning and start cooking, it won't be normal. If you get up at 8 and start cooking from 9, that's normal. That's you're following the biological rhythm. So I think there's a lot to say about when you do a certain thing, when you listen to a music. That's how all the ragas were developed. And these are Vedic hymns, originally going back. These are 3,000 to 5,000 years old. They were developed, yes, all the ragas are that old, basically, because they used to worship nature. There was for a Surya Namaskar, ending with Surya Pranam at the end of the day, like sun god was this source of energy. There was no electricity then. We had to rely on the sun to give us light for everything. Anyway, thank you for listening to me. And but many more thanks to Professor Kasbe for raising the idea, because there's not many in the whole world, I can tell you, Dr. Kasbe. Not many people are doing it. So keep doing the work. Approach Shantala Hegde. She knows you are speaking today. Sonal knows you. Oh, yeah, you are, I think, quite younger to them, because Sonal looks upon you as a sort of a very friendly colleague. Say, oh, to hamara aaya apna ka hai. We were talking about you. Like I said, I'll come and
yes, I received a message from her. She said she's with the organization since the inception, and I was happy to know that she's associated with it, and then I felt happy to be a part of it, because as you're joining today, and even she is already known to Hardeep
It's
sir.
running very well. It's running very well, all on the virtual platform. So I like the virtual platform because of two reasons. Sorry, I can go on forever. Because you see, everybody wants to meet. That's because we are all used to, yes, you wanted to give your contact detail to Roshan Lalji's daughter. Don't forget that. You made a promise.
Yeah. So that so this is just to share my acknowledgement and gratitude to.
I'm just reminding you, because the lady will.
Yes, sir. So, sir, thank you. Really, thank you for allowing me to be a part of.
Thanks, Sodhiji, for giving you the platform to.
Yeah. His name is. His name is.
So what I'm saying is that basically we should do, because the world has become very warm. Global warming is a real problem. All these planes flying around unnecessarily is adding to the ozone depletion and carbon dioxide level high. So it's good we don't see each other in a way. But, we are all social characters, so we want to, get around to each other. So there's a conflict there. Only the essential people at Kasbe will have to go and see a patient, even if it needs to be in Jammu. But you can do it virtually as well. Anyway. Thank you very much.
Yes, sure, sir. So thank you, everyone. Thank you, Hardeep sir and Professor Anandi ma'am for the.
Something. No. Sorry, Mr. Sodhi. I have taken up more than I should have. So
that's perfect.
So, DJ, we should have a separate session with
Yes,
Dr.
it's always a pleasure to hear from him. And yes,
that's what it is a pleasure to hear him. We can talk on many different topics actually.
I've been in England. You say it's a pleasure to talk to my own people, because I don't get to see my own people, and 1.5 years I haven't been able to go back home because planes are not flying. You see.
Yes,
so
sir.
And I think just like music therapy is a beautiful amalgamation of art and science.
Yes.
So maybe you as a doctor also, I think you are so many things put together.
I'm a human being. I've got only one life, and I want to live it to the full.
Beautifully said, sir.
Doctoring is a professional aspect, but at the end of the day, I'm a human being. I came to, live a full life, and, to enjoy being a human being, and to leave the earth when I have to leave a slightly better place than when I arrived, and definitely to make sure that it's no worse than when I arrived. Already I've made it more polluted in the last 54 years I've been working around here. That's why I'm so happy that the planes don't run, because everybody, European people are like, oh, we need to sit down and have a glass of beer or wine. I said, well, you have a virtual glass of wine. I have my coffee here. But why don't you just sit down and, yes, of course, essential people have to travel. But all we have suddenly in the last 1 year, we have realized that we are vulnerable. First thing, human beings, that whatever we take for granted should be honored and treasured. The air we breathe in, we've been polluting the planet. We have also become very selfish, but all of a sudden we realize that all of us can die at any one time together.
Yes.
So we must make sure that we look after each other. Human empathy. And we have actually done a lot more things about each other in the last 1 year, which we never did before.
Never did, yes.
You have done lots of things last 1 year, like helping a neighbor, helping an old person, or just going out.
Helping our helpers also.
Or helping somebody else. This we never did because we are suddenly becoming more social creatures. But the only downside is that we have all become very much addicted to the screens, and everybody has become very electronically addicted, for children particularly. But they're very lonely, as you said, the 1 year has been difficult for everybody. And these video chats have helped us because you see how much of positive energy I'm getting by speaking to you, you do not know. And this has been a common thing because we set up lots of things where senior citizens could talk to each other. At least they're not feeling that isolated. Just, because human beings are basically social animals. And we rely on each other for exchanging a few good words. If it's music, make music together.
Our emotional well-being is only because only if we connect to our friends, colleagues, relatives,
Yes. Yes.
That is where all this music therapy also and other therapies
will come in. It's very important. That's why you have our, in the temples, in the churches, in mosques, of course, music is not allowed. But, all religions have had a musical flavor to them just to bring the whole group in there. And then they can have this combined binding and, dancing with music, another movement. We have got an internal beat system which we develop because we just earlier on we were discussing Tai Chi, yoga, and various different aerobics, music and aerobics. You were asking about what music to play earlier on, wasn't you? I think you asked. I heard your question, but I didn't want to answer it. So yes, there is aerobic music, totally different. We have dance clubs in the for exercise with the mirror on the wall in India now everywhere. The children go and work out because you are seeing your own body image on the mirrors. That's why the mirror is there, and actually you're following your own body, persona. But that can be often detrimental for mainly women who have a fat shaming and all the rest of it going on at the same time. But they're dancing to a music, so that actually you are using the metronome, the beat, to move your arms and legs and head to that. So it's building up the rhythmic sense in the body. It's all to do with biology, human neurology. It's nothing different. But we have been doing this, we have the Sri Krishna movement, Hare Krishna movement. We've been dancing in everywhere, Garba dance is there. Anyway, so dance, music, healthy living, healthy well-being, obesity is a big issue.
Abhangs also we have in Maharashtra.
Yeah. So
we have Abhang in Maharashtra where also...
everywhere. No, dancing and singing are normal human pastimes. That's what we did 5,000 years ago when after dark we danced around the fire. And that was part of the communal living. And now we have all, just husband, wife and one child and a dog and television.
We have created an island for ourselves.
And a glass of whiskey.
Well, sir, thank you very much. It is always a pleasure listening to you. And, certainly, as Anandiji keh rahe hain, we'll have
another session.
We'll get together. Ashish, also, I wanted to thank Ashish. It was indeed a pleasure to have you. We learned a lot from you as well as Dr. Partha, and had a wonderful interaction. I see that we're almost approaching twice the time that we had. So we can close it for the time being. And certainly we look forward to having more such sessions.
I will again come. You have actually enrolled all of us for, I think, 7 or 8 serial one on Zoom. I found number of dates.
That is an open house session, sir.
Open house.
Essentially the same registration, which holds for the next sessions. We generally speaking have it every Saturday. So you're welcome anytime. Anytime the knowledge that you share is wonderful, sir. It's always a pleasure to
But
you.
we all gained today from Professor Kasbe's talk very much.
Indeed, yes.
And he's actually a very rare person who is doing it. So we must, and maybe the credentialing is important because public will ask this, which Mr. Sodhi kindly asked. Maybe you should speak to the medical council or get the IFNR to get Nirmal sir to work on it. I have spoken to him about it. Shantala should do that. Maybe from NIMHANS, they can use some certification. And then, because if you're a doctor, like I have a number, 48,752, like you should have a number and then, it's credentialed. So that's important, I think. Yeah.
Thank you very much again,
Namaste,
everyone.
Namaste.
Namaste. And we'll catch
Namaste,
up.
Roshan Bhaji.